Imagine walking into a clinic of the near future, not for a checkup, not because you're sick, but because you want to age better. Instead of a stethoscope and a vague, "Watch your cholesterol," the doctor greets you with a customized aging report pulled from a few vials of your blood. It shows your biological age, your oxidative stress levels, mitochondrial efficiency, hormone fluxes, and even how well your skin is regenerating. A detailed dashboard glows on the screen. Your NAD levels are tanking, your IL-6 is cranky, and your collagen turnover is somewhere between mildly sluggish and wrinkly Wednesday. But not to worry, the system has already designed your next 3 months of food, supplements, and maybe even a gene tweak or two. Welcome to the era of precision anti-aging, where your blood becomes your roadmap. This is the promise of blood-based precision medicine, a future where aging isn't treated with one-size-fits-all interventions, but instead with molecularly tailored strategies based entirely on your blood metabolome, proteome, epigenome, and microbiome metabolites. It's not just about catching diseases before they appear, it's about tuning your biology before it veers off-key. First, there's metabolomics, the biochemical fingerprints of your current state. Your blood is brimming with thousands of small molecules, amino acids, fatty acids, polyphenol, reactive intermediates, bacterial metabolites, redox byproducts, and energy substrates. When analyzed properly, this molecular soup can reveal your body's metabolic age versus your calendar age. Maybe you're 45 on paper, but 60 according to your mitochondrial respiration rates and urea cycle efficiency. Or perhaps you're secretly 32 thanks to your microbiome's excellent production of butyrate and indole 3 propionic acid. Rather than guess, metabolomics tells the truth, molecule by molecule. Then we layer on genomics and epigenetics. You may carry polymorphisms in the SIRT1 or FOXO3 genes, ones that regulate longevity pathways and cellular stress resilience. Or perhaps your methylation clock, calculated from 800,000 DNA methylation sites, shows you're aging 1.2 biological years per calendar year, and that last round of all-nighters didn't help. Blood-based epigenetic clocks, like Horvath's or GrimAge, are already being used in aging research, and future versions could go further, tracking dynamic changes in real time as interventions are made. Think of it like a fitness tracker, but instead of counting steps, it counts histone acetylation and senescence burden. Now add proteomics into the mix. From clotting factors to cytokines to collagen precursors, the proteins in your blood tell you what your body is doing right now, not just what it's capable of. A surge in fibrinogen, chronic inflammation, low BDNF, cognitive risk, off-balance matrix metalloproteinases, skin aging and joint degeneration. These proteins not only diagnose but could be targeted in real time with therapeutic peptides or gene modulation to push your biology toward a younger state. Even the microbiome enters the picture, indirectly, through the chemical whispers of your gut microbes that show up in your blood. Precision blood analysis could detect elevated LPS, a sign of leaky gut, low SCFAs, metabolic inflexibility, or spikes in TMAO, cardiovascular risk, allowing for microbial reprogramming with food, prebiotics, or postbiotic supplements. Some labs are already exploring this in pilot programs, combining gut sequencing with blood-based metabolomics to fine-tune interventions. In the future, you could walk away with a prescription that includes no drugs at all, just a hyper-personalized protocol. Eat fermented soy on Tuesdays to upregulate your NRF2. Take a low-dose NAD booster every other week to balance your energy flux, and avoid turmeric because your CYP enzymes process it too fast to be effective. Oh, and your tryptophan to indole pathway is sluggish, so your skin's losing barrier function. Cue the topical nicotinamide. This vision also brings the possibility of feedback-driven interventions. Want to know if that cold exposure, HIIT regimen, or acai bowl is actually making you younger? Run another blood panel and check your inflammatory and epigenetic markers. Personalized anti-aging wouldn't just be targeted. It would be measurable, adjustable, and iterative. You wouldn't be guessing whether a protocol is working. You'd see it shift your biological signature week by week. Of course, none of this is magic. It requires data, lots of it, and algorithms trained not just on healthy people but on long-lived ones, inflamed ones, frail ones. It needs AI that understands not just one gene or one metabolite, but how thousands of them interact in aging networks across tissues. It demands ethical oversight, privacy controls, and accessibility, so this doesn't become a luxury service for only the hyper-optimized elite. Still, the basic idea is quietly revolutionary. Your blood isn't just a passive transporter, it's a data-rich ecosystem that could drive deeply individualized care. We're moving from general wellness to biological fine-tuning. In this paradigm, the best anti-aging therapy won't come from a generic supplement aisle or the latest influencer trend, but from your own blood, interpreted through the lens of systems biology, decoded with precision, and acted on with intent. One day, anti-aging won't feel like a battle. It'll feel like orchestration. And your bloodstream will be the score.